The flu outbreak getting worse across the country and right here at home. Thanks for staying with us at 5:30. I'm Mark Taylor.
And I'm Ellie Merritt. It's been a rough year. Experts say this year the flu is far worse than last year, and the virus is showing no signs of letting up. Every part of the continental U.S. is under siege. One emergency room in Brooklyn reports a 30% spike in flu cases. In New Orleans, emergency rooms are at capacity. And in Dallas, there has been a tenfold increase in ambulance calls because of the flu. The deadliest flu pandemic was exactly 100 years ago, when up to 50 million people were killed around the world. NBC4's Courtney Yoon joins us now with Ohio's flu battle.
Mark, Ellie, this graph from the Ohio Department of Health really shows how intense the flu is this year. The blue line is a 5-year average here for influenza-associated hospitalizations in Ohio. The red line here is the flu activity we're seeing this year only. You can see the 5-year average is just at about 600 cases for this time of year, whereas right now we're about 3 times as many cases as the average, around 1,800 cases of flu here. An expert at OSU gives us some lesser-known tips to help combat the flu.
If some people start taking measures to make sure that the flu doesn't exist, and then that immunity can be transferred to others around you.
OSU professor of public health Allard Demby says preventing the spread of the flu is all about being diligent and using common sense.
People need to know that it's a serious public health issue.
Demby says getting a flu shot should be your first step, as well as frequently washing your hands and covering your cough. But there are plenty of things people might not think about, like sanitizing surfaces or washing your hats and gloves.
Flu viruses can live 48 hours after being deposited on a surface. The CDC, for instance, the Centers for Disease Control and Prevention, suggests that you let your cleaning solution stand for 3 to 5 minutes, so that it becomes really clean.
He says make sure to sanitize both at home and work. Also be aware of surfaces that someone carrying the virus might have come into contact with, like doorknobs, elevator buttons, computer keyboards, faucets, phones, or children's toys. Doing simple things like this can help stop the flu.
You don't want to be infecting others. You don't want to be spreading disease. You want to cut it off as soon as possible so that it doesn't really become a more extensive epidemic than it already is.
Demby also says to limit the time you spend around people who are sick and to stay home from work if you have the flu. And of course, another thing to be conscious of is the vulnerable populations, people under the age of 2 or over the age of 65, and of course, pregnant women. They definitely want to get the flu shot, and then you and I, if we're sick, we'd like to stay away from them.
Well, anything you can do to cut your risk, it's worth it.
Definitely.
Courtney, thank you.
Thank you.